Hello, my name is Jamie Corsa. Today I will be demonstrating how to do an ostomy bag as well as a rectal suppository and an enema. So right now I'm outside the patient's room in the med room. I have my healthcare provider orders and my MAR. So first what I want to do is just compare, make sure everything adds up. So we have our patient, Shirley Coase, age 54, Shirley Coase, age 54, date of birth 5/14/64, 5/14/64. First is the Docusate sodium 10 milligram rectal suppository administered for constipation. And if no results with the suppository within 12 hours, we will then be administering a sodium phosphate 4.5 fluid ounce enema. And right here, sodium phosphate 4.5 fluid ounce enema, PRN, if no results within 12 hours after suppository. So what I want to do first is hand hygiene, which is right here. As well as, again, check my meds. So right here we have the enema, the 4.5 fluid ounces, and then we have the Docusate sodium 10 milligram rectal suppository. There we go. So now I am going to don gloves. Okay. So first I'm going to take the Docusate sodium 10 milligram rectal suppository out of the thing here and put it into a med cup to have that prepared. As well as take the enema bottle out, 4.5 fluid ounces. And there we have that. Okay, so I want to make sure that is all good. I will then take my gloves off before entering the patient's room. And then I am going to knock on the door and enter. I will then introduce myself. Hello, Shirley, how are you today? My name is Jamie. I'll be your nurse. I want to make sure you also are providing privacy. And there we go. Move it up to right here. Okay, Shirley. So first what I want to do is just have you verify your name and date of birth for me. Okay, good. Just making sure that adds up with my MAR here. Shirley Coase, age and date of birth 5/14/64. Perfect. And allergy codeine. Making sure again here allergy codeine, which we won't be giving her any of that. Okay, Shirley. So how are you feeling? A little constipated. Okay, so the doctor today has he has ordered a rectal suppository that we will do, and this should help with constipation. Okay. So first what I want to do is I want to roll my patient over to the left Sims position. This is just going to be a little harder to do. Okay. Alrighty, perfect. So now what I want to do is I want to take, I have also donned gloves again and performed hand hygiene in the patient's room. So what I want to do is I want to take some lube and open it up. I want to put some in the cup and enough to put around there and to put some on my finger. Okay, so first I'm just going to let Shirley know of the procedure. Okay, Shirley, so what I'm going to do is I'm going to insert a rectal suppository. This should help you with the constipation. So what I'm going to do here is I'm going to get the rectal suppository and make sure there's enough lube on the end as well as on your finger here. So what I'm going to do is I'm just going to say, Shirley, if you could hold your breath, take a deep breath for me. This will just make sure everything's relaxed, and on the count of 3, 1, 2, 3. On exhale, you would insert the suppository as well as your index finger 1 to 3 inches, making sure it is past the internal sphincter, and making sure it's up against your rectal mucosa and it doesn't go into the feces, because then it will not, I guess, melt properly. So, okay, so after that, I would then let Shirley know, in 5 to 10 minutes, we want you to hold it in as long as possible. 5 to 10 minutes, we'll leave you here, and then we'll come check on you, okay? So then I would leave the patient's room, making sure I am taking off my gloves, I am performing hand hygiene, and also documenting. So then I would have turned my patient back over, but purposes of the video, we're just gonna leave her turned over because she's heavy. So now I am going to knock on the door. Again, come in, perform hand hygiene, as well as don gloves again. Okay, Shirley, so it's been about 12 hours since your last bowel movement. So the doctor wants me to go ahead and he ordered an enema for you. So we are going to do that. So before I do that, I want to make sure that I auscultate her bowel sounds before turning her over, which again, she's already turned over. Okay, so after that, okay, so we'll have you on the left Sims position again. So what I'm going to do here is an enema, which I will then have you take a deep breath again. We will go, I will insert the enema, and it'll be kind of a newer feeling. Let's just try to hold in as much as you can. So what I want to do first here is that, as well as lay a bath blanket on. This is just in case anything gets on. Okay, and I will also be putting this bedpan here, just in case the patient cannot control her sphincter, and if anything leaks, it'll leak onto here. Okay, Shirley. So what I'm going to do is I'm going to insert, making sure I have enough lube on here. I want to insert at a little bit of an angle, about 3 to 4 inches. Okay, on 1, 2, 3, take a deep breath for me. I insert it, as well as squeezing and rolling up the bottle as I am doing that. And when that is all finished, okay, again, Shirley, try to hold in as much as you can for me. And then for purposes of the video, because I am going to show you how to put a patient on a bedpan, we're going to say Shirley cannot hold her sphincter muscles. So we're going to roll her on to the bedpan here, holding it. A little bit more difficult. Okay. Making sure everything is good. The blanket's up. Okay. And for purpose of the video, I am not going to do it because this bed is very difficult, but you would then put the patient into a high Fowler's position. So, and you could either leave the room or not leave the room until they use the restroom. So then after that, you will check on Shirley and say, Shirley is done, you're all done. Okay, so what we're gonna do here is we're gonna turn you over again. Again, putting in the left Sims there, just turning over, making sure nothing's, there we go. We will then take the bedpan and the pad here and making sure that we look at the color and the consistency of it, as well as throwing it away here. There we go. We'll then take a tissue. We do not have tissue right now, and we would wipe the patient, making sure she is all clean before rolling her back over. And I would take off my gloves and don new gloves before rolling the patient back over. There we go. Okay. So we'll just get her all comfortable. There we go. Good. And get rid of the bath towel. Okay. All right, now that I am all done showing you how to do that, I will then show you how to do ostomy care. So the patient I would come into the patient's room, again knocking and performing hand hygiene as well as donning gloves. So the first thing I want to do is get my supplies out. Okay, so good morning, Shirley. How are you? Again, checking her wristband every time you're entering the room, as well as her allergy and comparing it to your MAR. Okay, Shirley. So today we're going to do some ostomy care. So I'm just gonna go ahead and change your bag here. I gotta go to the other side of the room. Okay. So what I want to do first is I want to put a towel, a pad right here, and rolling it, making sure if anything, if it starts to act up, then we have padding so it doesn't fall onto the bed. Okay, so first what I want to do is I want to have my bedpan. Everything being on the other side has me backwards. Okay, so I'm going to put the bedpan right here, and this is just in case if I need to drain the ostomy bag, the phalange, then I can do that, or I can put it in the thing. So what I want to do is you want to take this off and pull towards the stoma, and we are changing it, so this will just go right here for now. Okay, then I have this to tear off here, which you can get a adhesive pad to kind of help lift that up. Again, pulling away there. Okay, so then I would take a warm bucket here of water and make sure that I am just wiping around and cleaning up the stoma and the area around the stoma. Okay. After that, I would place a piece of gauze over it just in case it does start to act up. Anything that leaks out will be safe. Okay, I will then, I want to measure my stoma before putting a clean bag on. So lift up and measuring a little bit over so it looks like 1 3/4. Good. So because I cleaned the stoma up, I would want to change my gloves after cleaning it and then before putting a new bag on. So 3/4, I will go over here and I will trace. Trace around it. Okay. So I'll take my scissors and cut around it. These are sharp. Making sure you're moving your scissors because you don't want no jagged edges. Which this video probably, it might have some. Oh man, yeah, these scissors aren't the best for these type. These scissors aren't very good with this part. But as good as we can get. Again, for purpose of the video, it's gonna have jagged edges on. Okay, so before we do that, we want to make sure that we have our powder. So we will remove this and want to make sure that we powder around it. And then we will take our paste here, and we want to make sure that we are, I guess, pasting around the edge of the thing. This will seal it on there better. I just gotta take this off. There we go. Okay, so then we would do our paste right around the circle here so it will stick. And again, I said the powder, so then I would plant it on there. Ooh, with those jagged edges is just a little rough. Okay, after making sure that it is firmly on there, I will grab my my flange right here, and I want to make sure that I'm going to clip it, so just in case it does act up, it doesn't spill onto anything. So I want to go ahead and do that and just seal it in. Good. Again, making sure it's sealed. Okay. Take that off. All finished with your change there, Shirley. Also, just throw this away just in case it has anything in it. I would then toss this away, as well as documenting what kind of consistency and everything that we need to do. And then I would take my gloves off, perform hand hygiene, and just again making sure that I document. Thanks.